the topic of today is to help people to manage their own health. And I would like to share you insights into our views, our approach, and yeah, what does it actually mean? So to get things started, I think that what I have learned now, also with my last opportunities, is that we actually live in a world where people are striving for control and transparency. And I would like to give you two examples for this, which are not health related to begin with. And the first one is one of the last projects. I had the opportunity to work for the World Food Program and develop an app for them. And the problem actually we try to solve is that looking into donations today, many people are not sure or uncertain where the money is going if you donate something actually. And it's actually the people you want to help to receive the money as well. And therefore, there is a question or the people are hesitating to donate money. And we tried to look at this problem and provide a solution with Share the Meal. Share the Meal was is an app where you literally can donate with just 40 cents and help one child in need to feed him for one day. And with this app, we collected within the first month, actually, more donations than the World Food Program had in 1 year. And it was very impressive to see that with the transparency and control, actually more people are actively doing it.
Christian, sorry to interrupt you, but we don't see your slides. If you want to show them.
Oh no!
It's very nice you talking, but I imagine you want to show some slides.
Thank you very much. So I hope this now.
Exactly.
Yes. So here you see a little bit of a screen how the app Share the Meal actually looked like. Yes, and this was one of the examples. And then a second example I wanted to go in. I was also CTO and managing director of N26, a mobile first bank. And if you look back into how N26 was actually set up, the first idea was that we wanted to provide parents actually of teenagers to allow them and give them an opportunity to teach and educate their children, their teenagers, how to deal with money. And it was an app for the parents and then prepaid credit card for their teenagers, so that you actually can put money on the card and then you see where the money is spent by the teenagers. And the first investors into N26, the first angels, also have been exactly those kind of parents with kids in the age of a teenager. And maybe I've been asking them, how do you like it? They said that they are very excited about it. And we asked, how did their teenagers like it? Then they said, no, we didn't give it to our teenagers. We like the credit card because finally we saw actually where the money is going and how the exchange rates are, and they can control the card and activate and deactivate it. So it was for us very interesting. And control over their financials. And that was, so to say, the beginning of N26 out of that. So looking at those two products, I think that smartphones enable us to rethink industries from a customer perspective, because it's the first time that we actually have a really great mobile personal touch point with the users. And this is something which can change industries in the way that users now have the possibility actually in their hand to do something. And now let's look into the health space. In the health space is the question, how is it done there currently? And looking at the question, who is in control of your own health? And this was one of my problems also in the past, because when I, for example, visited the doctor, and he told me if I was sick or my state of health. Sometimes also the health insurance might know a lot about your health status. And then many people just after their doctor visit, and that's like, I think approximately 60% of the people, they actually Google it, what they actually have. And yes, this is something, is this really what we want and what we expect? And then if you look into the investments, which are actually going into helping you as a person to manage your own health, you see that only 1% of that is actually going into this area. About 99% is going to other areas like biotech, pharma, or medical devices. And we think that's actually the point where we need to start and to address it, because this is really something which is, from our perspective, essentially, and users demand that they have more transparency and control of their own health. So what is our solution? We created Vivy, which is an electronic health record with an assistant. And what it is that we want to provide you an easy and secure access to retrieve your medical data, to view your medical data, and use it. And we want to provide that from a base that the user, the patient, has full control over his own health data and what to do with it, with a complete transparency, so that you know also who is accessing and your data you shared the data with, for example. And for the user, this means it's an app, an iOS and Android, where you can have that literally in your palm. So I would like to give you a little bit more detailed view of what Vivy can do for you, and how we also envision people to manage their own health in the first version. So Vivy tries to help the user to manage his health holistically. What does it mean? On the one hand side, literally, we start with the beginning. You can find your doctor and make appointments with him, but then we would like to enable everybody to also exchange documents with his doctors. And that means that I can retrieve documents from any doctor as well as share with any doctor. And we have the fundamental principle that we think there shouldn't be in a way that you actually need to select or pick your doctor or your hospital based on some kind of electronic health record, but actually it should be supported or enabled by everybody. And that's what we are doing. We created a possibility for everybody, so that if your doctor wants, he can support you and provide you with your health data. This doesn't matter if it's like a lab data or an X-ray or other type of data. Then in the electronic health record, what you also find is the possibility to manage your medication, so that if you, for example, have diabetes or take a lot of drugs, you can manage your complete medication plan and get reminders. But not only that, for us, we think it's also essential to look into the drug-to-drug interactions. And giving you some example here, it's that currently, if you think about how many people are dying because of car accidents in Germany, it's around 2,000, 3,000, more than 3,000 people are dying in Germany every year based on car accidents. But if you take that into consideration with how it's about drug-to-drug interaction, you will learn that it's now, depending on which kind of source you take, it's rather 20,000 or more who are actually suffering of that kind of conditions. So what we want to enable here is that people start to be able to learn more about drug-to-drug interactions. And if, for example, I mentioned before, you have diabetes, but then you're at home and you go to your own medication you have at home, maybe like an aspirin, you can check if they are actually working together with what you have very easily, directly, by just scanning the aspirin, for example, and checking by that if it's actually compatible with your existing drugs. And then if not, or if there is any indication, you should consult with your pharmacist or with your doctor to learn more about this. Another way of how Vivy actually helps users to manage their health is that we have the possibility to manage your vaccinations within Vivy. And what you can do is that you enter and digitalize your complete vaccination pass, and receive reminders about when actually the next vaccination is due. And we learned, and one of the interesting findings is that really many people are doing that actually. And we learned that out of the users we have, that roughly 50% are entering quite early on their vaccinations. And we also expect, in Germany, there is the vaccination pass. And uh, typically people like me, they are looking for the pass, and because they don't use it so often, they don't find it. So we think also that many people are just not finding it, and that's one of the reasons why they're actually not entering it. Yes, so these are three key features. Maybe coming to one more, which is really, we think, relevant internationally, which is the emergency data. In emergency situations, it's really critical that emergency staff know about your conditions. Doesn't matter if it's like that you're pregnant or that there are certain diseases you have. To make a quick assessment. And for this, we provided people the help to actually manage their emergency data, but also access it. And we are providing here a QR code sticker, which you can put on, for example, a case of on your electronic health card. And the emergency sticker itself can be read internationally by every person who has, for example, a smartphone. And again, just to give an example of what I said before, it's that we think it's really essential that people have the full transparency. So once your emergency record is accessed, you get also a push notification that it's actually accessed. But the emergency staff has immediately the transparency on all the conditions and can help and brief maybe, for example, the staff in the hospital. So these are a few examples of what Vivy can do, but Vivy is not just an electronic health assistant. We started and launched Vivy actually now 2 weeks ago on the 17th of September, and we are working together with insurance companies who are providing Vivy to their insured people for free. And we started by working together with roughly 14 insurance companies, and therefore providing it for free to 13.5 million people. Just at the beginning, and based on the corporations we have, we anticipate that this will grow up to 25 million people on this side. So you see that we are building an open digital connected ecosystem where we have on the one hand side the user, the insured people, but we're connecting him with the doctors, and literally every doctor can work together with the user. And then we have the insurance companies, and every insurance company who wants can provide Vivy to their insured people today. So with this, what is the first thing which comes into your mind now that they have a health assistant which is connected? Security and data privacy is really essential at the base. And with my background, we building a mobile bank where the security standards are already really high. We think that this is the base for Vivy as well and for the complete health system, but it's not enough, and we need to go that extra step forward. And for that, we actually do an asymmetric end-to-end encryption of the electronic health record, which means that the data itself can only be read by the user himself, so that not us nor the health insurance companies can access the data. This is technically prevented by this kind of end-to-end encryption, where the private key to open the data is only stored in the phone and never transmitted. Which means also that for whatever reason, for example, if the police would ask for a health record of any person, we couldn't provide that because it's technically not possible to access the data. Then further, the app itself is working with anonymous personalization for any assistant by Vivy to the user to ensure that it's really helpful. So the user has really full control over all his data, and at any point of time, when he wants to use any data somewhere, he can make the decision to do that or not to do that. And this is just not said now by a startup, but it's also verified. So Vivy is not just certified by, for example, TÜV as a secure application where the TÜV is actually going into the app and verifying if that's what we are saying is also organizationally and technically sound. It's also certified by the e-privacy for data privacy. All data is stored in Germany. And with our partners, we have also audit rights, so they can verify that everything is really secure and done correctly as also communicated. So with this, I would like also to come to the end of the quick overview about what we are doing. Is our plan and our vision is really to empower users to manage their own health and make this really secure, but also simple and accessible at any point of time. Yeah, that was the quick overview, and I'm jumping back. I think I'm good in time to the discussion, and I think we are now open for questions as well.
Yes, perfect. Thanks, Christian. And by the way, sorry, I thought you're going to start discussing without or presenting without slides until I realized that it didn't work. So, but perfect. Yeah, we have some, I think, quite interesting questions. I think first we will go to Vivy, and because there is another one talking about Apple. But for example, Alison wants to know, how are the user incentivized? How about sharing this data with other providers? Yeah, obviously she saw the other presentation like Agamon. So what's the idea? Like me as a user of this system, what is the incentivation for me as a user?
So as a user, my data really wants to help you to retrieve data, but it's your data. You are doing all of it. It cannot be accessed to anybody. Doesn't matter if it's a doctor or if it's a health insurance without your explicit consent. And you must do that actively. Yeah? So there is no incentivization required from that perspective, but it's really just as a main purpose for the user. And with that, helping you to gather the data as a first step, we want to help you to understand that kind of data as well, and then use it. And I give you an example. I'm from Austria, and I moved to Hamburg some time ago, and going to the dentist, he asked me for the X-ray picture, and yeah, I didn't have one, so he made it again. And just 1 year later, I moved to Berlin, and again, I had to go to the dentist to check. And he asked me for my X-ray picture, and again I didn't have it, so he had to do it again. And but just if I would have been able to take that one again from Austria, I would have saved twice and two times doing the X-ray. But okay, it's my decision if I want to do that or not.
Yeah, okay. I think that's hopefully okay. And if not, you can still follow up with Christian for sure once we send all the information and the presentation. And Laura wants to know, like, can Vivy be used as identification, for example, if you're traveling? So I imagine, like you mentioned before, the example, if you go abroad, travel, you can use some of the information from Vivy in a hospital, correct? And this needs additional identification, or how does this work?
Mm-hmm. In Germany, you have an electronic health card, and this can be used to identify you, but it's not the same as a passport or a personal ID, which has a higher security standard. For Vivy, how we do the identification is that we actually ask you to show your personal ID or your passport, then we do a video, and then our staff does verify that the person is the person who is saying they are. And then we're also verifying the insurance status. So from that perspective, we have a qualified verification of the identity, which is really essential, but we need it specifically for the exchange of data with the doctors and vice versa. This is the key reason.
Okay, good, thanks. So here as well, if you have like any additional questions or you want to use Vivy outside Germany, happy to reach out to Christian. And another question is how many daily active users you have? And I think another question is like who feeds the account? So this is always the question now, who is getting or bringing all the data on your Vivy account? Is it your doctor? Is it this, or is it yourself? And then we can connect because we have 3 minutes time left to the very first question was like, what do you think about Apple? But now we get just another one. So one after the other. How many daily active users you have? Can you tell something about this?
Yes, so we just started, so that it's very hard to say currently what daily active users we have. Thanks to huge media outreach also at the launch, and also the active promotion of the insurance companies, we have really many signups, and I'm really proud of that figure. We will disclose that throughout the time, but it's really too early to say how many daily actives we have because it's just started. Sure. So we have really many active users, but then again, I think this is not measured correctly today. But our vision is, and that's very important, I think, is we just don't want to be a data storage in health, but we really would like to help people, not just when they are sick, but also when they are healthy, and be this continued assistant actually for your health.
Sure. And we have the question, I'm not sure if I share this, but more than happy to introduce you because Macrino, he wrote, we have developed a sustainable solution for medication adherence improvement. Are you already managing it? And he already wants to meet. So I sent this over to you and you can decide what you would like to follow up with him. Yes. And then the last questions I think is like, what do you think about Apple entering in the healthcare market? Do you have a statement about this or an opinion?
I'm really excited. I think Apple does. I'm excited. I think this is really great, and I think we need more companies actually help us digitalize the health ecosystem and connect each other. Maybe one of the key, there are a couple of key differentiators from us to Apple. With Apple, you are empowered on your iOS device to manage your electronic health record in the US, not in Germany yet. Okay. With Vivy, we allow you, we have a hybrid solution, which is very important because not everybody has a smartphone with terabyte of space. Yeah. Apple stores all your data on your phone. We think this is very hard with, for example, MRTs or X-rays. They can get pretty large. That's the reason why we chose the asymmetric end-to-end encryption, so that on the one hand side, we can store data, actually, in our case in Frankfurt in the data center, but nobody can access them there, but they need to be transported to your smartphone, where that's the only place where you can read them. But by that, we have more storage for the user actually, and they're not limited by the capacity of your phone. Then you maybe just want to take some pictures and then you cannot and must choose if you delete your health data or your pictures, which is, I think, very hard for some people, or would be. Okay.
Yeah, time, as I said at the beginning, is running very fast. We are already at the end. So thanks for making your questions, comments, and yeah, and thanks for you. Thanks, Christian, for this presentation. Wishing you great luck. Very exciting project, what you're working on, and looking forward what's going on next. And yeah, wish you all the best.
Thank you very much for having me. It was great.
Thanks. Okay. Have a nice afternoon.
Bye-bye.
Bye. Thanks.